Janice Rockwood is the patient care coordinator at the Craniofacial Center of Western New York. She joins us here on Medically Speaking today. Jan, thanks for being here.
Thank you, Mike. Thanks for having me. I'm honored.
Yeah, if you can, please first start out by talking a little bit about the Craniofacial Center and make sure that our audience is aware of what that center does and how it helps the community as well as Children's Hospital.
Sure. The Craniofacial Center was actually formed in 1988. It was out of the need to organize complex care for children with facial differences, such as cleft lip, cleft palate, premature closure of skull sutures, syndromic type children. And there were several caregivers at Children's Hospital that felt that their care of these children could be better managed if it was better coordinated. So I was actually the first person to be hired into this position, and I've been doing this job for 30 years.
That's great. Overall, you've been with the organization a little bit longer than that. We'll talk about that in a second. But your role as a nurse, as the patient care coordinator, tell us a little bit about what you do in that role, say day to day.
Sure. I am primarily the intake person for the center. All of the calls come through my office, either from primary care physicians, other caregivers at Children's Hospital, families call me when they move into the area, or any family that has a need that they feel would be better served with a team approach. We do not only see children, but we see people with cleft lip and palate and other concerns through adulthood. So all the children are seen by our geneticist, and they are given a genetic diagnosis, and then we put them into protocols so they see the right caregiver at the right time in their treatment plan.
So if you can, what's it like in that role and interfacing with the patients and their families?
You become very attached to the children and the families. You walk their walk with them through their child's growing periods and times of increased need. I've become very close to many of my patients and their families, and even see them socially at times. So I like that I can be the shoulder they can lean on. Families usually will come to me and recognize me, and they don't put me on the spot. They say, I don't know if you remember us, but, and then they give me a hint as to who their child was or who they were. We actually work with one of my patients that I met at birth. She has become our teen prosthodontist. So that's really a special relationship we have.
Yeah, what an incredible story. So the center itself has celebrated 30 years of service in the community. Tell us what it's like in the new hospital and the move from Bryant Street and being able to be located on the medical campus and to have that new facility for your patients.
This facility is just spectacular compared to where we tried to function in the old hospital. We outgrew it quite rapidly. And when I started, there wasn't, the variety tower had not even been built. And now I would say that this couldn't be better for families and the children. It's convenient. They come in and they can park without being out in the elements. They come right to the floors, or they come right to the clinics, and everything is centrally located in one building. So it's fantastic. So happy to see this happen in my lifetime.
That's great to hear. While the center is more than 30 years old now and serving the community, you recently celebrated a significant milestone, 45 years with the hospital, with Children's Hospital and Clyde Health. First of all, congratulations.
Thank you.
Second, can you tell us a little bit about your career path? I know you're a registered nurse by trade. Tell us what your career has been like with Children's Hospital.
I certainly will. I started attending nursing school to try to improve my chances of securing a job as a flight attendant, to be honest with you. In my nursing training, when I started doing clinicals, pediatric nursing just captured my heart. And so I started working nights in the emergency room, talk about exposure, in 1975, and I have been here ever since. Worked on almost every place in the hospital as far as floors, medical, surgical floors, the PICU, the emergency room, and the operating room. And I was working in the operating room about 10 years when this job opportunity came up, and I couldn't have had a better lead-in for craniofacial care because I saw all the surgeries that my patients now are having. So it makes me a better resource for them. That's exactly what happens in the OR.
Sure. So over that time, I'm sure you have a lot of great memories, seemingly touching every department in the hospital. Um, what are a few things that stick out in your mind over that 45 years?
Um, I think I remember falling in love with a little baby with Down syndrome when I worked on a medical floor. She was at the end of the hallway in a room, and no one seemed to visit her. So when I had a free moment, I would go down and kind of cuddle her. So
Yeah, as I was saying earlier, obviously a very emotional job. These types of ailments that the families are dealing with can be very traumatic or can be difficult to deal with. So it's good to see that, that our caring nurses like yourself who are there for the families to rely on. Um, we're in the midst of COVID-19. Western New York had its peak back in the spring. It really hit Children's Hospital. What kind of challenges did you face in your department with COVID-19? And, what are you most proud of as you guys have worked through that?
I think the fact that we pushed hard for our children to try to stay on track with the necessary surgeries that are very timely. Cleft lip repair, cleft palate repair, there are the best windows of opportunity to do those surgical interventions. And with our shutdown, that was probably our most challenging part of our department. But we tried our best to keep families calm, still address the needs of new moms that were delivering babies that needed to have coordination of care, and then again to push forth for the timely surgeries for our patients.
Jen, I know there's also another element to the program, the Craniofacial Center, and it's a parental element. So if you can explain how the parents are involved and what they do to help the center as well.
It's called Miles for Smiles, and I know a lot of people in the area are familiar with it. We've had many years of fundraising for 16 years and do an annual wine tasting, and that has benefited our patients to cover uninsured medical expenses and educational materials, welcome totes, all things that families need for comfort measures. So thank you to all the community for helping support our families.
Let me ask you about one more milestone as we wrap up here. You were recently elected, or earlier this year, you were elected to the National Board of Directors for the American Cleft Palate and Craniofacial Association. Tell the viewers what that means professionally, but really, I want to hear from what it means to you personally to have that type of recognition on a national level that, Children's Hospital is recognized as an expert, but also you in particular for your service and the work that you do.
I don't know if many people know what the ACPA is, the American Cleft Palate Craniofacial Association. I didn't know what it was before I took this job, but it's actually an international. It's called a national organization, but it's become very international. We have about 2,400 members from 70 different countries. And they're kind of the golden standard of craniofacial care. They want to optimize the care of persons affected with cleft and craniofacial conditions. So that's through team collaboration and education. And we use them as a resource for our families to purchase literature so that families understand their child's condition better. Being elected to the national board was just the epitome of what I'd like to do in this organization. And I'm very proud to represent Buffalo, being the first and only person that's ever served on the committee, and on the board. So I'm very honored with that, and I'm looking at this as my swan song before I retire. So got a couple years in me yet.
Hopefully not too soon. Congratulations on the board election.
Thank you. I'm very honored.
Janice Rockwood is the patient care coordinator at the Craniofacial Center of West New York, housed at Oishei Children's Hospital. Congratulations on 45 years of service to our community. Congratulations on your board of directors election, and thanks for joining us today.
Thank you for having me.